Hello and welcome. Today we're going to talk about a disease that is often called the silent killer. We're talking about pancreatic cancer. It gets this name because its symptoms are often subtle, easily mistaken for other, less serious issues, and frequently appear only after the disease has advanced. But what if we could learn to hear the whispers before they become shouts? What if they were unusual clues our bodies give us, strange signs that, if recognized, could lead to a much earlier diagnosis? That's our mission today. We are going to explore 8 strange and often overlooked signs of pancreatic cancer. This isn't about creating fear, it's about creating awareness. Because with a disease this serious, knowledge isn't just power, it could be the key to a better outcome. First, what does your pancreas even do? Before we can understand the signs, we need to appreciate the pancreas itself. Most people know it's in their abdomen somewhere, but what does it do? The pancreas is a vital gland tucked behind your stomach, and it has 2 main, critical jobs. Job 1, digestion. It produces powerful enzymes that help your body break down fats, proteins, and carbohydrates in the small intestine. Without these enzymes, you can't properly digest your food. Job 2, blood sugar control. The pancreas produces hormones, most famously insulin, which regulates your blood sugar levels. Pancreatic cancer occurs when cells in the pancreas grow out of control and form a tumor. Because the pancreas is so central to both digestion and hormone regulation, a tumor can disrupt these processes in very specific and sometimes very strange ways. Let's look at the signs this disruption can cause. Sign 1, itchy skin with no rash. This is one of the most unusual early signs. We're talking about intense, widespread itching, often on the palms of your hands and the soles of your feet, but it can be all over your body. What's strange is that when you look at the skin, there's no visible rash, no bite marks, nothing to explain the maddening itch. Why does this happen? One of the pancreas's neighbors is the bile duct. Bile, a substance made by the liver to digest fat, travels through this duct. A tumor on the head of the pancreas can press on and block this duct. When bile can't drain, a yellow substance within it called bilirubin builds up in the bloodstream. These bilirubin salts can then get deposited in the skin, causing severe irritation and itching. This is often one of the very first signs, appearing even before the next more classic symptom. Sign 2, jaundice, yellowing of the skin and the eyes. Jaundice is a more well-known symptom, but it's often preceded by the itching we just discussed. The same buildup of bilirubin in the blood that causes itching will eventually cause a visible yellowing of the skin and the whites of the eyes. Alongside this, you may also notice 2 other related signs. Dark-colored urine. The excess bilirubin is filtered out by the kidneys, making your urine look dark brown or tea-colored. And pale, greasy stools. Since the bile duct is blocked, the bile salts that normally give stool its brown color can't get into the intestines. This leads to pale, clay-colored stools, and we'll talk more about this next. While other conditions like gallstones or hepatitis can cause jaundice, if it appears without any abdominal pain, it is a significant red flag for pancreatic cancer and requires immediate medical attention.
Sign 3. Strange-looking, foul-smelling stools. This is a sign people are often hesitant to talk about, but it's critically important. If the tumor is blocking the pancreatic enzymes from reaching your intestine, your body can't digest fat properly. This leads to a condition called statorrhea, which has very distinct characteristics. The stools may be large, pale, and oily. They often float in the toilet bowl because of the high fat content. They have an unusually foul smell. You might even see what looks like an oily film in the toilet water. Why does this happen? It's a direct result of undigested fat passing through your digestive system. Your pancreas is supposed to release enzymes to break down that fat, but the tumor is preventing it. If you notice these specific, persistent changes in your bowel movements, it's a clear signal that your digestive system isn't working as it should. Sign 4. The sudden onset of diabetes. This is a fascinating and incredibly important link. If a person over the age of 50 who is otherwise healthy and not overweight suddenly develops type 2 diabetes, it should be seen as a potential warning sign. Of course, most cases of type 2 diabetes are not caused by pancreatic cancer. However, there is a clear connection. A study from the Mayo Clinic found that nearly 40% of pancreatic cancer patients were diagnosed with diabetes in the 1 to 2 years before their cancer diagnosis. Why does this happen? The cancer can damage the cells in the pancreas that produce insulin. With less insulin, your blood sugar levels rise, leading to a diabetes diagnosis. The takeaway here is that if a new diabetes diagnosis seems to come out of nowhere, without the usual risk factors, it is worth a deeper conversation with your doctor about pancreatic health. Sign 5. A dull, gnawing pain that radiates to your back. Abdominal pain is a common symptom, but the pain from pancreatic cancer has a specific quality. It's often a dull, gnawing ache in the upper abdomen that radiates through to the back. People often mistake this for a muscle strain or a back problem. They might notice it gets worse after eating or when lying down, and they might find that leaning forward provides some relief. Why does this happen? The pancreas is located deep within the abdomen, very close to the spine and a complex web of nerves. As a tumor grows, it can press on these surrounding organs and nerves, causing that distinct pain in the abdomen and back. If you have a persistent upper abdominal or mid-back pain that you can't explain, don't just assume it's a pulled muscle. Sign 6. Unexplained loss of appetite and weight loss. Like stomach cancer, unexplained weight loss is a hallmark sign, but with pancreatic cancer, it's often linked to a very specific loss of appetite or a change in taste. You might suddenly lose interest in your favorite foods. Things might taste bland or off. This lack of appetite combined with the poor digestion we talked about leads to significant and unintentional weight loss. You're eating less, and what you do eat, you're not absorbing properly. This is a double whammy that can cause rapid wasting of muscle and fat. Sign 7. Sudden blood clots. This is perhaps the strangest sign on our list. Pancreatic cancer cells can release chemicals into the blood that make it stickier and more likely to form clots. This can lead to a condition called deep vein thrombosis, or DVT, which is a blood clot in a large vein, usually in the leg. The symptoms would be pain, swelling, redness, and warmth in the affected leg. In a very serious scenario, a piece of this clot can break off and travel to the lungs, causing a life-threatening pulmonary embolism. If a blood clot appears suddenly without any clear cause, like a long flight or recent surgery, doctors will often run tests to check for an underlying cancer, with pancreatic cancer being one of the main suspects. Sign 8. New or worsening depression and anxiety. The link between the mind and body is profound, and this is especially true with the pancreas. A surprising number of patients report experiencing a sudden, unexplained onset of depression, anxiety, or a general sense of unease in the months leading up to their diagnosis. This isn't just a reaction to feeling unwell. Researchers believe there may be a direct biological link. The tumor itself might be releasing substances that disrupt brain chemistry and mood regulation. If you or a loved one experience a sudden and dramatic shift in mental health that feels completely out of character, and it's combined with any of the other physical symptoms we've discussed, it should be taken very seriously. What to do if you're worried? Hearing this list can be frightening, but remember, these symptoms can be caused by many other conditions. The key words to remember are persistent and unexplained. If you have one or more of these signs and they are new to you and aren't going away, it's time to become your own health advocate. Make an appointment with your doctor. Keep a symptom journal. Write down exactly what you're feeling, when it started, and how it affects your daily life. The more specific you are, the better. Be direct. Don't just say, my stomach hurts. Say, I have a dull pain in my upper abdomen that goes into my back, and my stools have been looking pale and floaty. Trust your instincts. Pancreatic cancer is a formidable disease, but it is not without its warning signs. They are often quiet, strange, and easy to dismiss. But now you know what to look for. Trust your body, trust your instincts. If you feel that something is fundamentally wrong, even if you can't quite put your finger on it, please seek medical advice. Listening to these strange, subtle clues is the most powerful first step you can take. Disclaimer: I must emphasize that the information presented here is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. Thank you for watching. Be well and take care of yourself.